This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
Be advised that the views and opinions of the hosts and guests do not reflect those of the station.
A dilemma is a situation in which one needs to choose.
Paano ako gagaling?
There's an ethical issue.
Supposed to
Help us.
Medical Dilemma.
Hi everyone! Happy Easter Sunday to everyone, and you are watching Medical Dilemma. I'm Attorney Sara Suguitan, your host for today. Today we're going to tackle vaccines, and with us is a distinguished pediatrician from the Manila Doctors Hospital and Associate Professor of the UPPGH, Dr. Sally R. Gatchalian. Hi Dr. Welcome to the show. Yes. Okay, Doctora, we are going to tackle vaccines today. And as a pediatrician, Doctora, how many vaccines na ba ngayon ang kailangan po for an infant?
Okay. Madami-dami yun, no?
Madami.
Although, what's good is there are now new vaccines that are called like 5-in-1 or 6-in-1, which means na sa isang bakuna, you can prevent 5 diseases or 6 diseases already. So that means the convenience of lesser trauma, kasi lesser injections to the child.
Yes.
So the vaccine preventable diseases, let's say, if we enumerate are, syempre, polio, diphtheria, pertussis, tetanus, hepatitis B, tapos yung Hib, which is a common cause of pneumonia and meningitis. And then you have measles, mumps, rubella, varicella. And
including
then you
chickenpox, Doctora.
Chickenpox, yun yung sa varicella, the chickenpox. And then, of course, there's the vaccine for HPV. There's the rotavirus vaccine, which prevents the most common cause of diarrhea in children, the rotavirus. So, meron na tayong bakuna nun. There's a vaccine for the important causes of pneumonia, like streptococcus, at saka yung Hib nga, like I said earlier.
Yes, Doctora.
Can prevent the more common causes of pneumonia due to an organism called Streptococcus pneumoniae. Tapos meron din tayong HPV vaccine, the human papillomavirus vaccine.
For infants.
And recently, we have the dengue vaccine,
the dengue vaccine
for children. For adults, meron sila yung herpes zoster vaccine, pero for older individuals lang yun. It's not for children. It's not indicated for children.
But Doctora, I mean, is it expensive po to like require all of that for a new mother, for example, to give all those vaccines to her child?
The vaccines against the more common vaccine preventable diseases like diphtheria, pertussis, tetanus, yung Hib, and BCG, yung for TB, prevents the complications of tuberculosis, are generally available in the local health centers. Okay, so libre yon for the general public. In private practice, the cost of the vaccine is reasonable.
Okay, so I mean, there's no reason why a newborn should not get all these
And of course, there's the vaccine for influenza then, which is not only for children, for kids, infants, children. Kasi ang indication ng influenza vaccine is for 6 months and older. So that's the influenza vaccine, which can also be given to the adults and the elderly. And then meron ng bagong bakuna, which is the Japanese encephalitis vaccine.
Yes, opo.
So
and also
there are new
pneumonia
vaccines that are coming out now.
Doctor, how did you come to specialize in pediatrics? Is it something you chose or something that chose you? Can you say that?
I guess I was making 3 choices actually when I graduated from medical school to go into a residency training. One was pathology, and then anesthesia, and pediatrics. Pero apparently, parang pathology, parang wala naman yatang action doon. Diba? So I said, no, that's not for me because I'm the kind of social kind of person.
Yes.
And second, anesthesia, parang ayokong nakakulong lang ako sa operating room.
Yes.
So, pediatrics, I thought, was more gratifying. You know, you treat a child who can't even talk and say what's wrong with him, and yet you're able to provide relief of of the symptoms that he's. So for me, it's more gratifying to treat a child than an adult.
Yeah, so that's how you felt, and that's eventually what led to your
Yes.
career direction.
Oo.
And also, Doktora, kasi like there are parents who believe that immunity should be natural, meaning and it's not a matter of cost, but they'd rather, pag nagkabulutong yan, magkakaroon na ng immunity kaysa ipapabakuna. What do you think of this
Well,
belief?
actually, that's true. If you get the active disease, you get protected. But will you let your child suffer the
There
consequences
you
of the
go.
disease? I mean, yung complications niya, that cannot be
Yes.
prevented by the active infection. Talagang pwede kang at risk for complications.
Yes.
So why will you wait for the child to get this disease when you can actually prevent the child from getting this disease? And prevent all the possible complications, morbidity, mortality
Yes.
associated with that particular disease.
Yes, and especially kapag bata, you cannot say that they can overcome at that young age na pag nakabulutong yan, they will survive it,
oo.
etc. Di po
And they're
ba?
the ones more at risk for complications for bulutong, for example. Kasi di ba, bulutong is very itchy.
Yes.
So they scratch a lot and they can get a severe complications from the scratching.
From the
Nagkakaroon ng
wounds.
super infection.
There you
Minsan,
go.
grabing-grabe. And, it can really involve one extremity, for example. It can be very, very severe.
Yes, there you go. So for all young mothers, and even those who are having children, they should really think of the future instead of nako, kailangan mas maganda yung natural yung immunity ng bata kasi lalo na ngayon with changes in medicine and a lot of new vaccines are coming
Yes.
up, as you say, that we should
Exactly.
avail of that.
Oo,
Kasi
and the vaccines now are a lot safer than they used to be before because they're now more purer. So,
Yes,
mas less na yung mga reactions sa kanila.
At saka
So,
kumbaga yung
vaccines are really safe. I'd rather prevent rather than,
Than
have a
cure.
child suffer the consequences and complications of an illness.
pero vaccines, Doctor, the only way to give that is by injection, no? Kasi ako
Yes, of
nabaliit
course,
ako, I
there
remember.
are vaccines that can be administered orally.
There you go.
Diba?
Meron din
You
po.
have the polio. There's the polio vaccine. And then, of course, there's the rotavirus vaccine. They can be administered orally. So, yun mga yon, oral vaccines yon. But the rest that we have now are administered through injection.
Kasi I remember when I was younger, yun yung nga yung trauma na sinasabi nyo, iiyak
Exactly.
kasi masakit. Or,
Oo.
although in your experience, may mga babies ba na, they receive an injection and they don't, react,
Well,
with,
sa baby, they do, no? Siyempre, they cry. But,
Natural.
with consoling, they stop crying naman. We see more of the anxiety amongst adolescents. Parang packet pa lang nila, alam na sila may injection. Mas, mas conscious sila about the injection. So, mas malaking problema nga with them.
they're more tense.
Yes.
And it, it leads to a longer,
Oo.
consoling
Oh,
time,
exactly, yes.
before they
But for
actually.
kids, of course, there's the pain of injection. That's why the coming up of these new vaccines, like combined vaccines, like six diseases that can be prevented with just one injection, is indeed a lot of convenience, less trauma, not only to the family, not only to the patient, but even to the physician.
Yes, that's how it's changed
Yes.
practice. So, Doctor, let's hold that thought, and we're going to discuss more about vaccines after this short break. Please don't go away.
So if I were you, I would be a lot more careful about what comes out of my mouth, especially in such a place where anything can spread like wildfire.
Why when you share something to a public, you find that experience, and that experience so rich it could change other people. Okay?
Like, there are other senses, right? So you hear it, you see it, and then you can smell the fireworks.
Now, would it be okay by asking, you're already practicing
use